many months and years of not being aware of this, what are some of the symptoms people might be dealing with that if they have these right now and they're watching now, we're coming across this video later, they should reach out to you or someone that can help them? What might they have if they don't know about it?
Yeah, I mean, a lot of the symptoms are, I mean, you start with the classic symptoms of Lyme disease, right? A lot of people know it as summer flu. So we see a lot of joint pains, muscle aches, fatigue, just kind of an off feeling. And then, certainly brain fog and headaches are other ones that come up with Lyme disease acutely. And what we see then is sometimes they come on slowly, and the next thing you know, you're like you were previously fine, and then out of the blue you get diagnosed with fibromyalgia syndrome, or chronic fatigue. But there's really, it doesn't make sense. Your diet's pretty clean, you're sleeping well. And so a lot of the people who come in with chronic fatigue and fibromyalgia, they're like, it doesn't make sense. There's no one knows this diagnosis, right? Like, why are we not, why don't they have a better answer for me other than, hey, we know what it is now, so it's, just deal with your fatigue, or take an antidepressant. They want to look for another outcome and another potential cause. And that's where a lot of people stumble into going, oh, maybe it was Lyme disease. And in retrospect, oh, you know what? I was bitten by a tick. Maybe they got treatment, maybe they didn't. But then it was like, 3 or 4 months later, their symptoms started. But the other thing that we see a lot of too is when we look at kids, they present differently. So they frequently they don't always have that classic, sort of joint pain, fatigue thing going on. And the rash, maybe we can talk about the rash at some point in a minute. But, so kids can sometimes have isolated abdominal pain. So your kid who's having belly pain for no reason, they've gone to the gastroenterologist and they've done the big old workup, but they don't know. But they're like, hey, we don't know. They don't have reflux. They don't have gastritis. So I don't know why they're having their belly pain. And that could be associated with Lyme. And also in children, you can see acute behavioral changes. And so like kids are reading at grade level and then they regress. And so it's like, okay, now they're reading like they're in 3rd grade, but they were previously reading at a 6th grade level. Their handwriting might regress. And very commonly we'll see emotional and behavioral changes. So the sweet kid becomes mean and obstinate, and it's completely out of, it doesn't make sense for where they are in their growth phase, or, they're becoming a teenager and challenging. It's like way beyond anything else you would expect. So, certainly behavioral stuff, and new school challenges where they can't remember things and stuff like that. So, and a lot of times like executives and like people who are out working, managers and stuff will be like, I don't remember that person's name. Like, how do I not know the person's name? I go to a meeting, I forget what we're supposed to be talking about, or I'm like, drawing blanks. I'm having word finding issues. And these are things that sometimes creep up on you, and it's just like, or you get a guy who's in their 40s who's night sweats. I mean, what guy in their 40s is going through menopause? Like none of them, so symptoms that don't add up. Or a lot of times if you go to the doctor, you'll be like, you have like 10 different things that don't all kind of meet up. And in medicine, we're always trying to get this thing called Occam's razor, like a single unifying diagnosis. But when you can't add things up, you kind of start scratching your temple and go, hey, maybe this is Lyme or one of the other infections that you can get from a tick.